My name is Caden Green, and today I'm going to be talking about the golf swing. So I'm showing you this image right here because I want you to keep in the back of your mind the two axes that are shown in this image. One, the 100C axis, and two, the 64 axis. These are the stable pieces of the golf swing that help generate power, consistency, and mobility, along with where most of the joints, muscles, and ligaments are located. In this video, I'm going to be talking about two joints. The first one is the glenohumeral joint. The glenohumeral joint connects the head of the humerus to the glenoid cavity of the scapula. The glenohumeral joint is a ball and socket synovial joint that allows for a wide range of motion, including flexion, extension, and rotation. The shallow glenoid cavity and loose joint capsule make the joint very unstable, which is why it's very susceptible to dislocations, and we see a lot of rotator cuff injuries in sports because of the glenohumeral joint. The next joint I'm going to talk about is the Z joint in the thoracic spine. This is also a synovial plane joint that connects neighboring vertebrae, and the facet joints work together in intervertebral disc to help stabilize the spine and bear a lot of our weight. They also guide and constrain a lot of our movements, and in the golf swing, this is very essential because it's mobile and it's good for generating power and consistency. Next, we're going to look at a real-life video of how these two joints move along with their movers and antagonist muscles in a golf swing. The first phase we have in the golf swing is the setup. The starting position, we are standing straight up, feet are on the ground, roughly shoulder width apart. The end position, the feet are still on the ground, hips are hinged forward, trunk is neutral, knees slightly flexed, and the arms are dangling in front of the body. From here, the glenohumeral joint has a tiny bit of flexion at the shoulder. The movers for this joint is gravity, and the antagonist is latissimus dorsi and the posterior deltoid. They are passively lengthening, which means the muscle lengthens without actually being activated. And then next we have the Z joint of the thoracic spine. Here it is fairly neutral to help maintain stability, and it's isometric, which means it's not concentric or eccentric contraction. And this happens because the erector spinae group helps prevent flexion and extension of the trunk. The antagonist here is the rectus abdominis, and it's also passively lengthening. Next phase is the backswing. The starting position of the backswing, we are in an athletic position, shoulder width apart, our arms are hanging, and we still have a neutral spine. When we end here, the trunk is rotated to the right, and the right arm is horizontally abducted, and the thoracic spine is rotated to the right. From here, the glenohumeral joint is horizontally abducted and externally rotated. The movers of this joint, the posterior deltoid, the infraspinatus, and the teres minor. This is a concentric mover. From here, the antagonists, the pectoralis major, and the subscapularis are eccentrically moving. In the Z joint of the thoracic spine, we are rotating to the right, and the movers for this are the right multifundus and the left external oblique. This we can see as a concentric movement. The antagonist for this is our rotators, contralateral rotation of our muscles, and this is also an eccentric movement. The phase 3 of the golf swing is the downswing. So at the starting position, we are still on the top of our backswing, our trunk is still rotated right, and the right shoulder is externally rotated. The end position of this, the trunk is rotating left towards the target, the right shoulder should be going into internal rotation and horizontal adduction. Our movement here, the glenohumeral joint is internally rotated and horizontally adducted. The movers for this, the pectoralis major and the subscapularis, and also the latissimus dorsi. All three of those are concentric movers. The antagonists are the infraspinatus and the teres minor. These are eccentric. At the Z joint, we see left rotation, which is quick and snappy to create a lot of power. The movers for this are the left internal oblique and the right external oblique. We can see these as concentric. And the antagonists are the right side rotation muscles, external oblique, and the latissimus dorsi. And we can see these as eccentric. Our last phase of the golf swing is the follow-through. From here we start, our body is almost back to its neutral point at impact, and then when we end, our trunk is rotated way left and our shoulder is internally rotated. At the glenohumeral joint, there is flexion, horizontal adduction, internal rotation, and for the movers of this, the pectoralis major and the anterior deltoid, and they are concentric. The antagonist movements are the posterior deltoid and the external rotators, and these are eccentric. Lastly, the Z joint, we see left rotation with some extension, and the movers that help this are the erector spinae group and the left multifundus. These are concentric. And then lastly, the antagonist movers are the contralateral trunk rotators that help us move from right to left. Now lastly, we're about to see the golf swing in full effect.